Well, folks, this is the end. By way of closing, remember back to podcast 1 and our overall objectives. You should be able to apply anatomy, which is Rule 2, and clinical patterns, Rule 3, to make a differential diagnosis for someone with a shoulder or elbow problem. You should be able to explain mechanistic and etiologic features of common shoulder and elbow conditions. You should also be able to define the role of common investigations and of the treatment staircase. So what did we actually cover? Well, quite a bit. With Devon, we covered shoulder trauma. With Carol, we covered some shoulder trauma, some degenerative shoulder conditions, and elbow trauma. With Elmer, we drilled into our rotator cuff syndrome. With Betty and Art, in the optional case, we covered shoulder arthritis. With Mark, we looked at the perils of being helpful and on elbow acute soft tissue injury. With Michelle, we looked at the problem of elbow tendinosis. Finally, although this podcast series is pretty comprehensive, it's going to take time to really understand and apply the topics herein. Just as onions and shoulders have layers, so will the growth of your clinical comfort and competence with this stuff. Hang on to the resources so that you can access these tools as you get to the next stages of your learning. If you have time, check out the self-assessment questions. Answers will be discussed at the live Q&A time.